Welcome Internet. Today we're going to be talking about premorbid schizophrenia. So for those of you who don't know, there are three main phases in schizophrenia. There is premorbid, acute, and remission. So acute is what is called a decompensation, i.e. when the symptoms become full-fledged, full force, mainly and mostly positive, i.e. hallucinations or delusions. And is the remission, in which it's treatment and trying to lessen the symptoms. But before all of that, there is the premorbid phase, or the prodromal phase, in which the symptoms are much more low-key. They kind of fly below the radar. It's often during that phase that people are considered at high risk, and if you're not trained in the detection of the symptoms, they can just slip through the cracks of mental health institutions, mental health professionals, and sometimes even the family, as they might think that it's a phase or that the person will grow out of it. Often the premorbid phase of schizophrenia happens earlier in life. It happens during early adulthood or late teenagehood. That's the, how can I say, the spectrum of when this form of illness starts happening. And often what happens is that there are strange ideas that start to develop, but as I was saying, they're not full-fledged, i.e. the person will not necessarily talk about them. They might keep them for themselves. They might be very private about it, because they will start to understand that they're experiencing the world in a very different way from others. They're going to start to often withdraw within themselves. They're going to talk less with friends, less with family. They're not going to spend that much time. They're going to isolate in their rooms or in the private sector of their house. They're going to start letting go of things that used to interest them. For example, if they were passionate, let's say, about chess, they're going to stop playing chess, and they're not really going to explain why. And you don't really get the feel that it's out of boredom or out of disinterest or lack of passion. It's more bizarre than that. It's just as if they had stopped and they had no real reason for stopping. It just ends. And often those people, when they go into those withdrawal phases, don't really want to see other people. They might often develop very specific way of seeing the world, i.e. they might start having very low-key delusions, believing in things that are more esoteric or more abstract. They might also lose some form of cognitive abilities. For example, they might be more rambling, they might have a harder time to explain what they think or what they feel. They might lose the thread of their thinking, i.e. from going to point A to point B, they lose themselves in between or at the end of a sentence. They start making less and less sense, or when they make sense, the ideas are odd or atypical, i.e. the things that people don't often think about, like telepathy, for example, bizarre religious beliefs, and so on and so forth. So what happens in those moments is that there is a strangeness, an oddness that tries to remain private within, but that people that live with the other can see. They can see it start blooming. So it's not, I can say, it's not completely private, and people with premorbid schizophrenia might even be kind of open about what they think, just not forthcoming with it. So if you don't ask them, they won't tell, but if you do ask them, they will tell you. Sometimes they might be very, very private, very withdrawn, so they might not even tell you, but sometimes they do. Also, there might be some form of cognitive impairment. So that cognitive impairment might be very strange in the fact that, for example, it's not on every level. For example, people with premorbid schizophrenia might very well be able to talk to you relatively well or be able to hold a conversation, but when you can ask them to do a simple task, like, for example, get the blue binder, they're not going to get the blue binder. They might get the red binder or the green binder. And at first you might think that they're ill-willed if they do that. But what you have to understand is that their cognitive impairments have started and that the illness is starting to gain some ground. There's also this very interesting possibility that cognitive impairment might be a form of defense, a mental defense to try and prevent psychosis from triggering. As I think that in those phases, what happens is that the mind is still very much divided, and what is happening is that the conscious mind is trying as hard as it can to push back against the anxiety that can be caused by psychotic elements. And what occurs also during those phases is that the individual might feel that others can't understand them or don't truly get them, that it's pointless to try and communicate what they're experiencing. And this furthers the isolation of the individual towards their family, their community, their environment. And often what happens is that when we work with these types of people, what we try to do is to get them in the premorbid phase, to already be within the, within the purview of the institutions, as often, immediate treatment might be needed if the acute phase happens, if there is what we call a decompensation, i.e. a break into psychosis. And what you have to understand also is that, according to me at least, people who have premorbid schizophrenia are fighting for their mental life, for their psychic and emotional life, as I think that at that moment the mind, as I was saying earlier, is divided. Like there's a fine line between the delusion and the sane part of the mind. And the sane part is trying its hardest to maintain a form of security, a form of sense of self. It's trying very, very hard. And I think that the symptoms we see are the price of that side of the mind, that sane part, trying its utmost to contain the anxiety and the anguish, as I feel that it's the anxiety and anguish that creates the path to the psychosis, as the psychosis does not happen ex nihilo. It happens because of a set of symptoms. And we can also think of trauma, as most people who have schizophrenia have also experienced a lot of trauma. And I would say that in premorbid schizophrenia, it's also a way of trying to cope with the trauma that has been experienced. So I think that in those moments it's very important to already have access to, for example, psychotherapy or sometimes medication, as it can help the individual once they're triggered it. Not necessarily contain it, because when it's triggered it's really massive, so there's no easy containment of it. But, and this is very important, what has been done before the decompensation is not necessarily lost. I.e., when the person is in a better mental space, is in a better state of mind, is more relaxed, they can then start to think, oh wait, it's true, I had started this therapy, or I had started this medication, or I had seen that mental health care, or I had seen that doctor. And all of these good experiences aren't lost for the schizophrenic individual, even if they get out of the premorbid phase and trigger the illness fully. So there is always hope, and that what has been built is not necessarily unbuilt by the triggering. So that's very important, because I think that that gives us hope as clinicians and hope for the patients, that things don't have to just worsen and degrade and just break completely and life is over. Quite the opposite. What it needs to happen in the premorbid phases is that the building blocks need to be put in place, I think, to secure the individual as when they're going to trigger, or if they trigger, should I say, because let's be honest, this is not an exact science, so we can't be sure that someone with premorbid schizophrenia will trigger it. They might live their lives without ever triggering it. That's very interesting. And in French we have a concept to talk about these people. We call them psychose blanche, i.e. white psychosis, that there is a psychotic element, but it never happens and never becomes acute because the person is stabilized in their mental frames, in their lives. They have community, they have a form of existence within themselves, a sense of self, and they have a stability, a very good stability that makes them not unable to trigger it, but much more resilient and much more, how can I say, strong in terms of mental health. So therefore they don't necessarily trigger it. That doesn't mean that those who trigger it are weak, quite the opposite, they're very strong people. But unfortunately the mental defenses, the mechanisms have not been able to prevent them from, unfortunately, entering the acute phase. So in terms of treatment, unfortunately nowadays, at least at time of filming, we don't have any way as mental health professionals to prevent the decompensation. We have no way of maintaining it for sure in the premorbid or prodromal phase, which means that we are not necessarily always able to help the patient not trigger it. However, what we are able to do is to create the, how can I say, the building blocks, as I was saying earlier, the very basis to which the person can expect healthcare, they can expect treatment, they can expect to not be alone, and that's very, very important. As in my experience, what happens is that people with schizophrenia feel deep sense of loneliness, and at least knowing that they can have all of that creates a form of humanization, that they're not dehumanized, they're not treated as a pariah or an outcast. They're part of humankind, and I think it's very important in the premorbid phases to be able to build that fact that whatever happens, they'll be always part of humankind. There's also, I think, a whole work to be done with family, as family is often, and especially nowadays where mental health institutions tend to basically be worse than they've been for about a century, to take on the role of helping the individual with schizophrenia. I think there's also a whole preparing families to the eventuality of psychosis. Maybe not with those words, because they can be very scary, but telling the family that there might be a moment of crisis, that it's very important that they tell the healthcare professionals that they have to work with us and we have to work with them. It's also very important. We have to create an alliance for the individual with schizophrenia to be able to benefit at maximum from healthcare and from community. So here you can see that I've basically blended this idea that healthcare is linked with community, because I do feel that in schizophrenia they all, of course, have to have medication and psychotherapy. Those are very important, but I also do think that if they're integrated within the cultural or religious or social settings, that it's much better in terms of prognosis, that the individual might even sometimes basically heal from certain aspects of the illness through community, through having a stable sense of belonging, because that's very important. And I think that that's something that's underestimated in the West or under-evaluated, that we need to have a whole plethora of options for people with schizophrenia. That it's not just medication that's going to do the trick, it's not just therapy, it's community, it's integration, it's being fundamentally at the core humanized. And I think that that's very important, to humanize the individual, because even though we might not be able to stop schizophrenia from occurring or becoming acute, we might just help the person be humanized enough for them to be able to internalize that feeling and make that same part of themselves strong enough to be able to maintain a form of strength in regards to the illness, and be able to invest themselves and care about themselves also. So that's fundamentally my take on premorbid schizophrenia. I hope you found it interesting. If you want to add anything to the conversation, or feel that I didn't do justice to a topic, or that you want to add something, please feel free to do so in the comments. I'll see you in the next one.